Hello, everyone, and welcome to this session of the Safer Births Now virtual conference. My name is Dave Johnson, and I'll be moderating today's session entitled The Momnibus Blueprint and Stronger Systems, a Public Health Overview. Today, I have the great pleasure of introducing Congresswoman Lauren Underwood, co-author of the Momnibus Act. And it is a great honor and privilege to be able to hear from somebody who has written this. And so without further ado, so we can jump into it, Lauren Underwood. Thank you.
Well, thank you, David. Hi, everybody. Am I still here? Okay. Hi, everybody. I really appreciate the chance to connect with everyone this evening. For those of you who I haven't met yet, I'm Congresswoman Lauren Underwood. I have the honor of representing Illinois' 14th Congressional District. I'm a registered nurse, and I'm the co-founder and co-chair of the Black Maternal Health Caucus. David, I appreciate your introduction, and to the full leadership team and staff of Birthing the Magic Collaborative and all the partner organizations. I saw those logos in the pre-roll. Thank you for having me here today and for organizing this event. It really means a lot to me and every member of the Black Maternal Health Caucus to have your partnership in this fight to end America's maternal health crisis. What you're doing here matters. This gathering brings together families, clinicians, and advocates to share real, practical resources. And that's no small thing. This is how we save lives, by making sure families have the right information, support, and care they need before, during, and after pregnancy. I want to begin by acknowledging up front that we're living through a scary and uncertain time for healthcare in America. It should not be this hard to do the right thing, but friends, we cannot back down from this fight. The United States has the highest maternal mortality rate of any high-income country, with significant disparities in outcomes, particularly for Black women. This is a crisis in our country, and it's only getting worse. The statistics are devastating, and they're more than just numbers on a page. For many of us, this crisis is personal. For me, it was my friend, Dr. Shalon Irving, who lit the spark. I enrolled at Johns Hopkins University in 2008. I was 21 years old. I was fresh out of my undergraduate nursing program. And right away, I was intimidated during orientation because my classmates had all these really incredible credentials. But I met two friends on the first day of class. Shalon, who had already she already had a dual doctorate in sociology and gerontology, and Reagan, who was a practicing OBGYN. Shalon was warm and friendly and made me feel completely at ease. And we became fast friends. And then 9 years later, in 2017, as I wrapped up my service in the Obama administration, Shalon gave birth to a beautiful baby girl named Soleil. Shalon was so excited to become a mom, but a few days after Soleil's arrival, Shalon began showing signs of serious postpartum complications. Shalon went to the doctor 3 times during what turned out to be the last week of her life. Shalon died of preventable pregnancy-related complications on January 28th, 2017, only 3 weeks after giving birth to her baby girl. Shalon's life and her story have never left me, and I'm grateful to be able to honor Shalon's legacy in partnership with her mother, Ms. Wanda Irving. Shalon's death, like 80% of pregnancy-related deaths in the United States, was preventable. And that statistic, well, it infuriates me, but it also inspires me because I know that by working together, we can fix this. So with that goal in mind, Shalon's memory motivated me to co-found the Black Maternal Health Caucus with Congresswoman Alma Adams 7 years ago this month. With 53 founding members, we created the Black Maternal Health Caucus to organize around the goals of elevating the maternal health crisis and advancing policy solutions to improve maternal health outcomes for every mom and family in America. Since then, we have grown to become one of the largest bipartisan caucuses on Capitol Hill. We are committed to advancing the comprehensive solution to our maternal health crisis, and that is called the Momnibus. The Momnibus is a comprehensive package of 14 evidence-based, data-driven bills that address every driver of maternal mortality, morbidity, and disparities in the United States. It includes investments to grow and diversify the perinatal health workforce, to expand access to maternal mental health and substance use care, and to lower healthcare costs. The Momnibus also makes improvements in technology innovations, it closes research gaps, and improves data collection, and provides direct federal funding for community-based organizations who have been working on the front lines of this crisis every day. In short, the Momnibus is designed to solve America's maternal health crisis. And I'm excited to tell you that we have reintroduced the Momnibus for the 119th Congress. Now more than ever, we need your voices. We need your advocacy and the incredible energy of this community to solve this crisis and save moms' lives. In just 7 years, the Black Maternal Health Caucus has made incredible progress to advance the bill. We've seen the first Momnibus bill signed into law, the Protecting Moms Who Served Act, and it's already improving care for our veterans. And then, since our founding, we have pushed for more robust maternal health research, leading to the creation of the NIH Improve initiative. Improve stands for Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone. Since then, we have successfully increased annual funding for Improve to 9 times the amount it was originally funded for. And this Congress, we introduced bipartisan legislation to authorize that funding for an additional 6 years. The Black Maternal Health Caucus has also secured new federal investments to study maternal health disparities and support community-based care. Now, this includes the Maternal Health Research Collaborative, which is a program based on the Data to Save Moms Act in the Momnibus to establish the first ever federally funded research network to study maternal health disparities at historically Black colleges and universities and minority serving institutions. Now, those investments are being put to work through the community-based perinatal health initiative at HHS too. And that is a program that's based on the Kira Johnson Act in the Momnibus that directly funds community-based perinatal health services for moms in areas with high rates of adverse maternal health conditions. What does this mean? It means that altogether we have secured hundreds of millions of dollars for new federal funds for Momnibus priorities. And that's before the bill has even been signed into law, you guys. So this funding has stood up maternal health centers of excellence, directly supported community-based orgs that are providing maternal health services in high-need communities. We've funded midwifery education and training, and so much more. This is what progress looks like. But we know that our work is not finished. So while this funding is already flowing into communities and improving maternal health care across the country, we need the full Momnibus to be signed into law ASAP to comprehensively address the full scope of the crisis. So yes, I am very proud of all that we've accomplished together so far. And it is, of course, really important to celebrate our big wins and work together to protect those wins, especially in a moment like this when we are seeing such deeply troubling setbacks in pretty much every aspect of our American society, but certainly in healthcare. Donald Trump and Robert Kennedy Jr. are dismantling critical life-saving health programs that support moms and families. And their attacks are putting everybody at risk. So you probably heard last summer, the Republicans passed their dangerous legislative package called the Big Ugly Bill. And that is the single largest healthcare cut in our nation's history. The Big Ugly Bill cuts more than $1 trillion from our healthcare, including the largest Medicaid cut ever. And we know that those cuts are going to hurt moms and families. The data is really clear. These cuts affect all of us, even cuts to programs that you personally may not use because they have rippling effects across our healthcare system. Medicaid and Medicare cuts mean that hospitals will close and they will not be coming back. That's going to make it harder for moms to get the care that they need in a country where too many families already live in maternity care deserts. Now, fortunately, based on the broad bipartisan coalition that we have built together, most of the Momnibus funding that we've secured has not been cut. In fact, we got an increase in funding for the NIH Improve program in the most recent federal funding package that was signed into law in February. So that's a huge win. But we cannot let up because a few of our Momnibus and maternal health priorities have been targeted by this administration. For example, two projects from NIH Improve have received stop work orders. Our longtime partner leading the initiative at NIH, and that's at the center called, or the Institute, the National Institute for Child Health and Human Development. Their director was dismissed last year. And the CDC, the Centers for Disease Control and Prevention, has cut the staff who implemented the Pregnancy Risk Assessment and Monitoring System, also known as PRAMS, which is the longest standing maternal and infant health data survey. So um, we've just learned that Donald Trump's fiscal year 2027 budget proposal will include a 20% cut to NIH funding overall, which would undermine the very research that helps us understand and prevent maternal deaths. And so, listen, guys, like I'm not trying to discourage anybody, but I want to encourage us to keep going, to be clear eyed about the full scope of what's happening. And, we don't want to get complacent. We certainly can't assume that just because the Momnibus money hasn't been completely cut, that we're totally fine. I'm really counting on you guys to help us keep the momentum going. So please call your members of Congress, Republicans and Democrats. Please call your senators, Republicans and Democrats, and ask them to co-sponsor the Momnibus. And no matter what district you live in, whether you have a Dem or a Republican, we need everybody's support in this effort. So on our website, meaning the Black Maternal Health Caucus website, which you can Google, just Google Black Maternal Health Caucus. It'll take you to the website where we have something called a Momnibus Money Tracker. And that's where you can find out what funding has already come to your community. And you can mention it when you make your call to your rep or your senator so they can work hard to protect those funds. Please tell your stories to your members of Congress about the impact and the reach of the Momnibus dollars in your communities because addressing the maternal health crisis is not a partisan issue. No mom in America should feel fear or uncertainty about their pregnancy. Um, I believe, and it's the perspective of our Black Maternal Health Caucus, that every single mom should feel the joy and wonder and hope about bringing a new life into the world. Like, that's what we're fighting for. And so I know that there's probably folks on this call who've had near misses or who've lost a partner or sister or a friend, a loved one, a neighbor. And, these deaths and near misses should never happen. And hearing the stories from families and loved ones and survivors is why we keep going. I'm honestly, every mom deserves to come home safe. And that's what this moment demands of us. And that's what the Momnibus is about. So, as I close, I just want to call out to one of my heroes, Congresswoman Shirley Chisholm. And she famously said, if they don't give you a seat at the table, bring a folding chair. And I ran for Congress in 2018 because I believed then, and I still believe now, that people of conscience needed to stand up for our shared values. And that is even more true today. And in this moment, we need your leadership. We need to hear from people who care about what's happening to moms in our communities, who've seen the impact of the maternal health crisis firsthand, and who know what's at stake. So, thank you for showing up at this virtual table tonight. Thank you for your commitment to keep showing up for all of our moms. Please keep telling your stories, and thank you so much for your commitment to this work. I really appreciate the opportunity to say hi to all of you tonight. Thank you.
Thank you so much, Congresswoman Lauren Underwood. The impact, the inspiration for bringing your lived experience to the floor and making this happen. It is very, very powerful. And we hear you call
Yes,
our stories, right?
yes.
And be advocates for sure. Anything else you want us to take away as another point that as we go out there and spread the word?
That's it. Co-sponsor. So, Senate, House, Dem, Republican, that's what we need.
Okay. Thank you.
Thank you.
Message received. All right. So As a reminder, Safer Births Now conference brings together clinicians, researchers, innovators, parents, their loved ones. We appreciate all of you here. You just heard from the Congresswoman. We will now shift and we're going to hear from Dr. Naya McMillan. Thank you for joining us, Dr. McMillan. Dr. McMillan is the founder of Public Health Doctor, is a mission-driven public health executive, educator, and strategist with deep expertise in translating the complex, like sometimes the Momnibus or any regulation, to something that we can all take with us and be able to have a bit of a conversation. So don't forget, put your questions into the chat. And without further ado, Dr. Naya McMillan. Thank you, Doctor.
Thank you so much, and good evening, everyone. Thank you for having me. I am Dr. Naya McMillan. I'm the founder and CEO of the Public Health Doctor. And as David mentioned, we are a health policy concern that is focused on being advocates for. We ensure that the voices of the community are not only heard, but also prioritized in shaping health policy and practice. And Congressman Underwood has underscored that our mission is aligned and clear in terms of what we need to do to move forward in supporting maternal health and improving maternal health policy and practice throughout our nation. Throughout my career, I've worked with federal agencies, healthcare organizations. I worked 14 years in the largest healthcare organization in the world in an effort to integrate equitable practices into our health and our policy. The things that Representative Underwood highlighted here are unfortunately very true. 80% of maternal deaths are preventable. Black women experience 3 times more the rate of death than white women, or any other race for that matter. Black women experience maternal health issues much more. And this happens long before even pregnancy begins. We have disparities that occur in terms of healthcare, access to healthcare, insurance coverage, long before pregnancy, and that often dictates and determines health outcomes during pregnancy. When we look at the postpartum period after childbirth, this is one of the highest risks for maternal complications. We currently don't have the systems in place to provide adequate care after a child is born. Typically, there's only one follow-up, maybe 6 weeks after birth. And this is inadequate, and it doesn't catch everything that we need to catch. These disparities are not only driven by medical factors, but also by broader structural inequities, including racism, poverty, transportation barriers, provider shortages, inadequate access to nutrition and health, inadequate insurance coverage, and lack of access to culturally responsive care. And those are the things that the Momnibus bill is actually targeting, and why it's so important for us to move that forward. So thank you again for having me today. Thank you, Safer Births, for having me today. And just wanted to thank Congressman Underwood for her unwavering leadership and her continued advocacy around maternal health.
Absolutely.
Thank you all for joining today. I see some people, so shout out for to Baltimore, because I saw some of my neighbors joined as well. But thank you everyone for coming. Definitely recognize the time, and this is just reflective of your commitment to this work.
So we got one question that came in, and apologies to the person who submitted it because I did not see the question while Representative Underwood was on. But as you mentioned, you talked about disparities with regard to maternal health. And the question is Black and brown women still a priority population in Momnibus?
Yes, I think Momnibus is focused on maternal health inequities and disparities that are present in maternal health. Black women continue to lead in terms of the highest population that are affected by negative maternal health outcomes. They have the highest death. the highest infant mortality rates. And so it would go without saying that Black women would be the focus of it because they are experiencing the highest levels of disparities and the highest negative outcomes as related to maternal health care.
Thank you for that. So then, just a couple things. When we look at it, and Congresswoman Underwood gave us a call to action. What are any other things that you would look at or highlight, not only with the Momnibus bill, but are there any other things you'd like to highlight for us or make us aware of, or ensure that when we are calling our representative, that we might also, in addition to telling our story, talk about fill in that answer or give us that point if you don't mind.
Yeah, I think there are two major issues. I think the first challenge that people experience before, during, and after childbirth is insurance coverage. Some people are uninsured, some people are underinsured, or some people experience delays in enrollment. There are tighter restrictions on insurance companies now. We are seeing more denials, more reversals of coverage, and more surprise bills. So, insurance coverage is definitely something that we need to be talking to our representatives about because this not only affects maternal health, it affects the times before and after birth, and it also affects coverage for the infant that is just being born. The next issue that I think we should highlight is provider access. That is a major issue, especially for individuals that are living in rural areas, in underserved areas where there are medical deserts. We are seeing now many hospitals are closing, and hospitals close, they do not come back. This means people have to travel further and longer to get the care that they need. And this is going to impact situations where emergency care may also be needed, where time is of the essence. And these barriers separately, they pose their own risks, but cumulatively, they pose an even larger risk because they start to stack on top of each other. So, where you might have insurance as a challenge, you also have provider access as a challenge. And then one of the other issues is that the lack of cultural competency in some of our providers is lacking. Black women often complain about being ignored, being dismissed during childcare, having their concerns disregarded, and not believed when reporting pain or symptoms during labor and delivery. We've recently seen some high profile cases where they have been delayed triage or people have been discharged during active labor. I saw something the other day about a woman refusing a C-section, and they were challenging her choice for that. So these are things I think that we should be highlighting, and also be aware and prepare ourselves for, not only if we are the person giving birth, but if we're supporting individuals that are in that position as well.
Thank you. Definitely great points. Sorry, the sun is setting and where I am, but at least the sun is shining, right? So
Yes.
a couple things just to direct to the questions is that you can also submit questions regarding the Momnibus to Representative Underwood's office. And so that came in. That was fantastic. Got another question. How can Black families protect their rights in healthcare settings? And just as a dad myself, I think about whether we're having the preliminary visits, early visits with OBGYN, or we're thinking about doulas or any of those things. How do we, two things. One, how does the mom ensure that they're getting the care that they need? And then also for those that are providing support, that they're supporting the mom properly as well as advocating properly. Can you tell us about that a bit?
Yeah, sure. I think one of the most important ways families can protect themselves and improve their care experience is by having a trusted advocate present whenever possible. Now, we understand that can't always be possible. Someone can't go with you to all of your meetings, but we have technology now. So there may be ways for someone to virtually attend your visit. This advocate can be a spouse, a partner, a parent, a sibling, a friend. My best friend went with me to almost every one of my visits, or some other trusted support person. Be sure to understand the questions that you want to ask before going in. We have a lot of information at our fingertips. Some of these things we can look up before so we can prepare ourselves for some potential answers and some concerns we might have based on some of that feedback we expect to get. Um, also, during pregnancy, that particular advocate can communicate concerns when the mother cannot. If something feels wrong, and they can also ask for additional explanations. Their role is not to challenge the provider, but to understand what's going on, to understand the communication, and to ask critically important questions to support the mother and the parents in that situation. Um, just generally, and this isn't just for Black women or Black patients. This is for everyone in terms of advocating for their care. Families should know that they have the right to ask questions when you're visiting a provider. This is a partnership. It's not you do what the provider says without any conversation. It's a partnership. It's care for yourself. Here are some questions you may ask are, can you help me understand why this is necessary? You can also ask, what are the risks, benefits, and alternatives? Um, if you are feeling uncomfortable, you say that. I do not feel like my concerns are being addressed. Can we pause and discuss this further? This wasn't what we initially discussed. Let me take a second to research this and let you know how I feel about this moving forward. And if you still feel like you're not being heard, you can always ask for another provider or a supervisor to come and speak. Um, you can also ask for a medical review of the decisions that are being made. These questions help families feel more informed, more confident, and more involved in decision making, and also let the providers know that you are fully invested in your care, and that you have an advocate for your care as well.
Those are definitely great insights. And so I got a couple follow-ups on that, and then we got some questions flowing. But the first one is that the trusted advisor, uh, what's the why there? Is it an additional set of ears? Are they eyes? Are they a witness? Or can you tell us a little bit about and help us with their purpose so that when we're having that conversation, it's easier to say, I need you there because.
Yes, all of the above. All of the above. There are extra set of eyes. There are extra set of ears. There are extra extra brain in the room to ask questions that perhaps you hadn't thought of. There is a lot that you are responsible for remembering. And when you go into the doctor's office, it's always good to have a partner, a backup, someone actually advocating for you. And then when mother may not have the wherewithal to be thinking critically to answer the, and that's why you would need someone there trusted. Also, communicate in ways that you normally would. You are definitely straight to have another advocate there with you during that time.
Okay, thank you. So, question, in your opinion, who are the voices missing from the conversation? And examples, faith-based organizations, pharmacists, pharma, med tech. Who do you think isn't there? Do you have any insights?
Can you repeat the first part of that question? Who is the
Who are the voices missing from the conversation?
from right currently now?
Yes.
I think I think that everyone I think that there have been contributions from every part of maternal health in this conversation. I think what is missing is a cohesive message between all of us in terms of the actions that need to be taken. And I think that's what the Momnibus bill provides. It says, hey, these are the things that are wrong. These are the things, the ways that we would like to move forward. So I don't necessarily feel like anyone is missing from the conversation. We just have to reiterate the messages that each one of us is sending to make that impact heard.
Keep showing up, and some more than others at other times, but we just keep coming with waves of voices and different perspectives. Is that fair?
Absolutely.
Yeah.
Yes, definitely.
Then bear with me. Interesting question. I think this would be in your wheelhouse. When you have review boards that look at outcomes and see trends, how do you get policymakers and insurance accountable for poor outcomes? So accountability for,
Uh, I work and with insurers for many years. I have found that the thing that moves them is revenue. Encourage insurers to actually implement better quality practices in terms of the health that's provided and to address concerns that are brought up by review boards is to show them the cost benefit of that change. Unfortunately, sometimes the story that this is better for the person is not enough. Um, Many companies operate by the bottom line. And if you can show them that it is cost effective, I know this sounds very odd, but this is honestly how business works. If you can show them that it's cost effective, it costs them less money to save the lives by implementing this practice than to let this continue. Um, then perhaps that practice will be implemented. However, it's not a fast practice. It's not something that is put into place. The advocacy that you see outside of the health system actually goes on inside of the health system. There are the health systems, the insurers, the providers, the large health systems. There are people like me at work inside the system trying to make systems more equitable. And so while you may have these facts, we have all of these facts, we have all of these stats, we have all of this research, and nothing has moved so far. So that's not enough to move organizations. In my opinion, money is what moves. If we can connect the dollars to better quality health outcomes, then I think we will see more movement by the healthcare companies. But again, you need advocates inside to advocate and to amplify the voices again. And so we have challenges not only um, within these huge systems, but also outside of the system that are all advocating for the same thing. And then, and only then, I think you will see change. Change is very slow in these organizations, and typically the organizations are following CMS practices in terms of policy, quality, and reimbursement for services.
very powerful. Thank you. Uh, how do we get big insurance to cover doula charges the way Medicaid has? Any
Man, that is
thoughts?
something that I have wanted. I've wanted that for a long time. I have advocated for that um, significantly. I think that would be such an improvement to healthcare. There are some small efforts in place, but there's not a larger effort right now. And this goes back to excuse me, there doesn't seem to be an immediate push in terms of if this is going to change policy in the immediate future. There are many advocates for it. I don't have a singular answer to that. I think it's going to actually have to unfortunately start in the federal government because again, insurance companies tend to follow practices for their reimbursement. So if the federal government is not covering it under their health programs, typically the insurance companies will not offer it, or they will offer it as a part of a different package or an extra package for your insurance. Or maybe if it's a private insurance, they will offer additional maternal health care programs. But right now, that's something else that we need to be advocating for. Doulas have demonstrated immense improvements in healthcare quality, especially for women of color. And they have also demonstrated lower mortality rates, lower infant mortality rates, lower infant morbidity, and and higher quality of healthcare for a lower cost. So the writing is on the table. The numbers are there. We just have to move them into action and have people at the table that are making the decisions advocate for this. But unfortunately, that's where another disparity lies, because there are very few individuals who look like us that are making the decisions at these healthcare organizations to advocate for some of these things. Not only, and I'm not only talking about race and culture, I'm talking about gender as well. So if you have not been through a childbirth experience, if you have not been pregnant, then it's very difficult for you to understand what's needed during that time and to implement that into policy.
Yes. Yes.
So we need
Thank
diversity in every sense, at every level, to make sure these things move forward.
you. How can administration support frontline clinicians in implementing evidence-based interventions that we know reduce disparities? There's a lot there.
I think that is a question specific for the particular health system that you work in. I'm not. I know that there are some systems that are way more inviting in terms of taking guidance from supporters, supporting providers that would influence the way healthcare is administered, and in other ranks. In that so I think that's something that would be dependent on each specific health administration system. Some systems also, I know that the hospital where I gave birth, they asked for feedback from parents, but you never know where that feedback is going. So I think that really is dependent on the specific health system situation, where you can create a group or some type of advocacy group among nurses or other support clinical staff to provide guidance or feedback, at least, to the providers at your organization.
Thank you. So of the voices, sorry, of the voices that are being heard at the table, how does legislation address, reduce, and eliminate the root causes of the disparities inherent in Black maternal mortality and morbidity? I don't know if my internet was a little glitchy. Did you get all that? Oh, am I? Did I freeze?
I can hear you, but the question got cut
Yep.
off.
Up,
I can hear you,
okay.
David. Did I
I
freeze?
think so.
You're a little
Better me
glitchy,
than
Dr.
you.
Naya McMillan.
What's that?
You are a little glitchy. There
Oh
have been a couple
no.
of times that you've at least on my end, I don't know if it has for other
Yeah.
people.
But the bulk of the answer has come through. So of the voices
Okay.
of the voices that are being heard at the table, how does legislation address, reduce, and eliminate the root causes of the disparities inherent in Black maternal mortality and morbidity?
Oh, the legislation. Okay. Um, so the legislation actually focuses on evidence-based research that was done in terms of maternal health. So what it does, it's important because it recognizes that maternal health is not only about what happens in the delivery room, but about the policy systems and the social conditions that shape health long before pregnancy and then again long after birth. So it acknowledges maternal mortality and morbidity that are driven by multiple factors. It addresses access to care. It also addresses provider shortages, transportation, insurance coverage, housing instability, mental health, implicit bias, and structural inequities. So it seeks to address each of these factors that contribute to the high maternal morbidity, and mortality rates. And it's valuable because it addresses maternal health comprehensively, like I mentioned. So supports things like workforce development, postpartum coverage, data collection, community-based supports, and also investments in the social drivers of health, which are so important because we think about prenatal care visits, but we don't think about, well, what's mom eating? Is she even getting what she needs to eat? Does she have a safe place to sleep? Does she have a house? Does she have a roof over her head? Some of the basic things that we need in terms of health are addressed through this bill. So it addresses it collectively, comprehensively, and with all of these things addressed, like Representative Underwood mentioned, there are things that there have been wins on, but we need comprehensive coverage of all of these things in order to make an impact.
Thank you. Thank you for that answer. There's great conversation going on in the chat. Definitely keep that up. Welcome any more questions. Dr. McMillan, is there anything else while we wait to see if there's any follow-up questions? Anything else as a result of these questions that you just want to drive home or point to for our audience today?
Yeah, so I'm just looking at the chat, and it seems to be a lot of conversations about doulas, which is very important. So someone, and apologies for not remembering the poster's name, mentioned about one of the challenges with doulas, and also this is similar to community health workers, that the definitions for that particular profession are different in different states that may affect reimbursement. I know when I inquired specifically, and I live in Maryland, my particular insurance did not cover it. I was told, I think it would be a flat fee. I would not be reimbursed for it. And I think I was quoted, I think 4,000 or 45,000, excuse me, 4,000 or 4,500 for my pregnancy, which honestly, considering the care that they give is reasonable, but it was something that I could not pay out of pocket at that particular time. So I am fully invested in advocating for doulas to be covered by insurance. It just makes the most sense. But I will say that midwifery and doulas incorporated, they also have a history that is tinged with racism and inequity and inadequate recognition of the practice in attempts to lessen the professionalism of that particular industry long before we came here today. Because as we know, there have been inequitable practices in medical care in terms of how women of color, particularly Black women of color, have received care. When we were denied care earlier, many of the cares that we received were from midwives in terms of maternal health. And so again, this goes with cultural competency. When we have providers that are culturally competent, we have better health outcomes. And so this would be great. This would be a great improvement in maternal health. And so I definitely agree with many people in the chat that it's something that we should also support as well.
I don't see any other Sorry.
No, I was just saying, I was just going through looking for questions myself.
Oh, yeah. I don't think we're seeing any other questions in the chat. If somebody thought there was one that was missed, please drop it back. I'm afraid it sounds like. Please.
While we wait, I can share my own birth story, and it's unfortunate. It seems like everyone has a story, which is another reason why this is so important. We all don't need to have a tragedy story or a misery story or a story where we felt like we were treated inadequately while giving birth. So my story is this. About probably 6 weeks before my child was due, I checked my blood pressure because that is what I'm supposed to do. And I noticed that my blood pressure was, I think it was about 160 over 100. It was very high. And I went into the doctor. They said, thank you. You did the right thing to come in. At that time, I was labeled as a high-risk geriatric pregnancy, and I was already getting seen twice a month anyway. But this was on one of the off months. And so if I had not had the wherewithal to check my blood pressure every day, then I might not have caught it. So I went in, they were able to lower it. And then about 2 weeks later, I went in for a normal routine checkup, and my blood pressure at that time was like 170 over 100, which they told me was very close to a stroke territory. They told me I needed to come in, and they took me in, and they decided that I needed a C-section, that the birth needed to happen then. I think it was about a day or two where they tried to bring it down. Anyway, this was during COVID, so I was already concerned because this was a week. They had already said no one can come into the delivery rooms. This was my first child. I was terrified. I told my husband at the time that we were going to New York because there was no way that I was going to have a baby by myself. A week before I had my child, they changed the policy, and they let one person in, and that was fine. I had my child early. My child was in NICU, and I had a C-section. After the C-section, the C-section, they put the baby right here. Oh, nice baby, and then the baby goes. That was not enough for me. After I got back in my room, I wanted to see my child, and they told me my regular doctor wasn't there. They told me the doctor that was there. He said, "Oh, the baby saw the fully
I think
prepared
you're glitching
to
again.
flip the hospital upside down, because at that point I needed to see my child, and there was no indication of when that would be. It was just like, and then in walked angels disguised as nurses. Both of them looked like me. She said, "Don't worry, we are going to take you to your child." Mobile monitors, and wheeled my entire bed to NICU. And as you know, the first moments, the skin to skin, that's very important. And they took me there the next day as well. The third day, I had different nurses, and they refused to take me to see my child. And so this is why it's so important to have culturally competent care, to have diverse care, and to actually find providers that listen to the patients. Because while the physician was not listening to me, the nurses were listening to me. They knew my distress, and they figured out a plan to do that without the physician's input or guidance, and actually against what his leadership indicated. So I'm forever grateful to them. We need more. We need more diverse, more competent care, and we need more providers like those nurses that I had who actually listen to the patient.
Thank you
So
for
that's
sharing.
my story. And I know that I'm preaching to the choir. Everybody is a full supporter of this. And I hope that we can continue to move this forward so that we can eliminate that 80% of preventable deaths. That's
Mhm.
unconscionable. And also 3 times the death rate Black women have. That's something that we need to also address and get under control. And this is just the first of many conversations that we'll continue to have and continue to move this forward. And just grateful for everyone's engagement and support
Thank you for sharing.
on this
And I think that the key piece that you're talking about is that you were seen and heard.
issue.
And oh, you're glitching. I'm sorry. There you go. Okay. Sorry. I was speaking on you. It was glitched. Go ahead, Dr. McMillan.
Okay. I don't I guess it's glitching. I guess the internet. Yeah, I'm not sure. I'm not getting any issues on my end, so I'm not sure when it's
It's
happening.
all good. It's all good. I think
Okay.
one of the key pieces was that the importance of being seen and heard, right? And
Yes,
so
absolutely.
we talked about who was here, but want to say it again for those clinicians, those advocates, and the like. Thank you, and keep standing up for your patients when you see those moments, because not everybody, while they see, they might not be hearing, or they might not be empathizing, understanding. And so continue to do that. We have a couple more questions, I think, in a few more minutes. Bear with me. How do you address those families that choose not to be attended to because the person giving the care may have an accent, is not American, even if this puts the mother and child in danger? How do you help to be able to break down those barriers, or what kind of information, what would you say with regard to that?
I mean, I think everyone has their a choice in terms of who they like to be their healthcare providers. I think the question is asking, how do you combat racism and bias in terms of providers? Yeah, that's what I feel like the root of the question is, and that's unfortunate. I mean, I've heard and I've seen. I have a lot of friends that are clinicians as well, and I've seen stories about that as well. I think that you just keep your professionalism, as I know that you are. You provide the best care that you can. I also understand that this is quite an issue in like memory care or caring for patients that have dementia. You often will get remarks that are unguarded and offensive. And I think that's unfortunate. But at the end of the day, people have free will. They can make the choices that they want. If someone asks me not to attend to them, I don't know what the protocol is in a hospital. Admittedly, I've not been a clinician, but you would only have to tell me once. But I'm sure you can't just walk away from your patient. So you can just do the best that you can. I work with people that I don't care for, that I know are blatantly, against everything that I stand for. I've been in meetings where people have told me, when I've said we need to provide better resources to underserved communities, we need to have mobile clinics where there are hospital deserts. And I've been told that we're not running a charity. In a meeting full of CEOs, these people would never ever say this publicly, but they express their feelings, and you can tell exactly who they are. And so this is something that's not new. This is what we are up against, and we won't let them have the final say. We will continue to advocate for what we know and believe is important and true.
Well put, for sure. Uh, One other question that I think, in rural areas like mine, not mine, but the question, where our hospital no longer has labor and delivery, this goes back to
Yeah.
Momnibus. What specific support or funding does this Momnibus bill provide for community-based providers like doulas who are trying to bridge that gap? And how do I get access to the resources to share in my community?
Yeah, so first we have to get the bill passed, and then those resources should come to bear. This is not going to be an easy feat, especially in the landscape that we're currently in. In terms of specifically what supports would be offered in rural areas, I grew up in two very distinct, different areas. I grew up in the Bronx, New York, and then I grew up in a very small town in South Carolina that had one stoplight. The hospital that was there is closed now. So I definitely understand those concerns. The nearest hospital, I believe, is 50 miles away from where my grandmother lived, on a dirt road with no sign on it. So I understand deeply the challenges in rural health. What I am hoping that this bill would bring to bear is different types of resources like mobile clinics, mobile maternal health clinics that can actually go to these places and provide care. Other options, including telehealth, so that you can actually communicate with a provider, even though you might not see them. I also hope that this bill supports transportation, to actually provide transportation for women to go to their particular doctor's appointments, and then also workforce development for doulas and community workers that actually live in the community and can provide low-level clinical care support for individuals in their community.
And in addition to call your senator, representative, right, your local, and when you talk about a resource, provide that to individuals in your community so that there's more calls and the like.
Yes. And I also like to mention, like, I know we tend to say, call your representative. Yes, that's very important. But we also live in a world where a lot of attention can come through social media. So if you see a post, commented on it, elevate the conversation so that you're seeing it, so that more people are seeing it, more people are aware of what's going on. Everybody has, I shouldn't say everybody has a story, but most people that I speak to have a birth story that has, perhaps is not the best. I mean, sometimes you have a nice outcome and sometimes you don't. And I think we need to elevate those stories so people know how important this is, and that it's not just rare. It's not just, oh, this happened to one person and you continue to scroll. This is happening every day to many people in many communities. And I think it's important for us to also elevate that conversation. So it's also with our Congress representatives, but also in our communities, so that we understand how serious it is and how we can impact that ourselves as well.
We are coming up on the hour. Great questions have come in. I'm going to look real quick. New messages, birthing. And I think we are coming to time. So if I can, first, Dr. McMillan, thank you so much. Incredibly insightful, perfect match with regard to providing us more information on Momnibus, but then also answering a bunch of great questions and facilitating great conversations to the side as well as here. So thank you. For those in attendance, thank you for your time. We know you have all kinds of places to spend your time, and you chose to spend it with us talking about this very important issue. We know that you will go out and you will continue to be advocates. You will hear and see not only patients, but friends and family. Keep making an impact with this, and have a good evening. Thank you.
Thank you, everybody.